Good morning, Mr. Chairman. My name is Fred Birnbaum with the Idaho Freedom Foundation, and I stand in strong support of this bill. And actually, I think I want to respond by starting, we do have a gun to our head. It's a financial gun, and that's why this reform bill is so important. I've given you all a 2-page handout, and I know it's hard to look at a lot of numbers early in the morning, but if you start on the first page, this was put together by Doge, and you look at the third line, it's the Medicaid and healthcare spending changes from fiscal 19 to 24. The bottom line is, of those three programs, the big ones, Social Security, Medicare, and Medicaid, Medicaid is the fastest growing. 30% real increase, inflation adjusted, from 19 to 24 versus 11.9 for Medicare and 16.6 for Social Security. And then Doge went on to do a income adjusted change. And again, Medicaid and other healthcare programs, it's the highest at 17.7 versus Medicare is almost flat, Social Security 5%. And I think it's important to understand when people talk about we're getting federal dollars, these are borrowed federal dollars. When Medicaid was voted in, federal debt was 22 trillion. It's now over 36 trillion. So these are borrowed dollars. So we talk about money to the state. This is borrowed money. On the second page, which you see is what was promised and what has happened. So this is some detail on the cost changes. And what you see, original appropriations have gone up 238%. And I didn't start in 2020. I started in 2021, the first full year. And one of the biggest drivers is cost per enrollee. And that's up 88%, way more than inflation. So we do have a spending problem. A gun is to our head. And this bill, if we don't do this now, what will we do? Nothing has been done yet. This is a necessity. Thank you, and I'll stand for questions.
Committee, any questions? Representative Kaler.
Mr. Chairman, I believe the Representative Fuhriman had his light on, so I'll yield to him.
He's had his light on almost the whole morning. There was a reason I was skipping over to you first.
Copy. Thank you, Mr. Chairman. A question for the presenter.
Yes, questions in order.
Thank you, Mr. Chairman. Mr. Birnbaum, so question I've got, why was the budget miss so large?
Mr. Birnbaum.
Mr. Chairman, Representative Kaler, great question. So I think it's several things. Milliman did the estimate, and frankly, they got it wrong. And what they underestimated, and you can see that if you look at that page, the second page, annual cost per enrollee. So in fiscal 21, it was about $6,637, and now, at least based on the 26 requests, it's $12,461. They completely blew the estimate of services. And I think the reason for that, I'll just give you a simple analogy. If you went to the gas pumps and there are no prices, and you filled up your car and the bill just went to Idaho's Department of Transportation, you probably would not be price sensitive. There was a whole notion that if we expanded Medicaid, people wouldn't use the emergency room, they'd use less services. It just didn't pan out. And frankly, when people talk about access to health care, what we haven't seen is really an improvement in health outcomes nationally. We're told about a drug crisis, overdose crisis, a mental health crisis, and this is when we're spending billions of dollars. We spent way more than we said. We spent way more per patient than we projected, and I don't think just giving people access has improved healthcare outcomes, particularly if you see life expectancies declining.
Hey, do you have a follow-up yet, too?
For follow-up, please.
You're learning from Representative Fuhriman. I can see that. Quick follow-up. And just a reminder to questions and to the presenters, try to keep everything short because we do have a long list and I'd like to try to get as many people in. I don't want questions to increase the talking points.
Mr. Chair, thank you. Mr. Birnbaum, so would you just briefly explain what the outcome is if we do not reform Medicaid expansion?
Mr. Birnbaum.
Mr. Chairman, Representative Kaler, that's a big question, but I think all you have to do is extend this trajectory a few years. So if we've grown it at, and this again is full year to full year, 238%, this is the original appropriations, in 4 years, if you extrapolate that, it's unaffordable. But there's also going to be federal pressure, because you can see from my first page that it's not sustainably federally. And we already know that we have 36 trillion in debt. So I think we'll have a financial crisis nationally if entitlement programs like Medicaid, and particularly Medicaid, are not addressed.
Representative Fuhriman.
Thank you, Mr. Chairman, and I won't overstay my welcome. I'm sorry.
You've already done that, so I mean,
Mr. Birnbaum, I have a question for you about your numbers. You're quoting Doge here. Is that correct? That's the source?
Yes, Mr. Chairman.
Yep.
Okay. So, and you've mentioned Milliman a few times, and I think those are the numbers we're throwing around. My Milliman numbers that I have show that fiscal year 2024 was in fact an enrollment of 100,094, same as you have here. But the projected for fiscal year 2025 is 90,062, and that currently Idaho is on a trajectory this year to only be at around 85,000 people enrolled. So my question is, coming back to what I said before to Representative Redmond, there's so many numbers being thrown around. One of the first things I learned in my college statistics class is that 73% of all statistics are made up. So can you please tell me, as a legislator who has to vote on this, which numbers should I use?
Mr. Birnbaum.
Mr. Chairman, Representative Fuhriman, I actually like that question a lot, because you're not actually going to nail me, even though you might think you are, because I went to the legislative budget book. If you look, there's a rolling estimate. It changes that people come on, people come off. So if it's 98,000 or 103, these are the numbers. And I went through the legislative budget book, and you can look at the forecast, and then you can look at the fiscal report, the actual. You could take an average of the year, you could take a midpoint, but that does not overwhelm the issue, which your costs are totally out of control. Milliman said a little over 400 million, maybe going up to 600, and now it's 1.36 billion. And no, the 90% federal money is not free. It's debt that's going on your grandkids.
Not seeing any other lights on. Thank you, Mr. Birnbaum. Next.